So thanks, Chris, for coming in and doing a PCBH Corner. Would you like to introduce yourself?
Sure. Hi, my name is Chris Hunter. I'm a clinical health psychologist, and I've been working in primary care for the last 16 years as a behavioral health consultant.
So one of the things that I think has been really nice about doing these videos is that we get to ask people that write the books, that do presentations, kind of like what got them into primary care. So what's your story? What got you into kind of primary care? What got you interested in primary care behavioral health?
Yeah, I think that's a good question. When I was going through graduate school, I focused on, did a behavioral medicine subspecialty. And so my interest has always been, unlike a lot of psychologists who might focus strictly on the mental health piece, I've always been interested in behavioral medicine, interventions, assessments, and that's kind of where I went with my internship. I did my internship with the United States Air Force, and was lucky enough to do that with my wife. But we looked at internships all over the country, and they had an internship that allowed me to get what I thought at that time was sort of the best breadth and depth of behavioral medicine training that was available. And as I went on and went to past internship and I was working in clinics, and my wife and I were the behavioral medicine specialists. And so we'd see patients coming into the clinic, and we saw a whole range of folks for tobacco cessation, insomnia difficulties, diabetes management, chronic pain. And what I started to see was we were getting people after they'd been through all kinds of other specialties, and we were getting them sort of as a last kind of result. Oh, let's go ahead and send them to mental health and see if we can get something done. Yeah. And we were still able to, effectively help the folks that would come to our clinic. But I started to look at, or to think about, well, what would happen if we could get these people kind of at the beginning of their problem instead of after they've been suffering and had so much dysfunction for so long? And so at that point, I started to kind of look at, well, what are people doing? This was around, I'm going to date myself here, around 99, 2000, and so I had started to see some of the things that Kirk and Patty had written, and that there were a couple edited books out that just sort of fascinated me. And so I sort of learned as much as I could and started to try to work with our primary care clinic. And then I had the great fortune of being able to, the Air Force was going to start a demonstration program of training psychologists to work in primary care, and they had hired Kirk and Patty to help kind of design that program. And so I ended up going and working in a clinic and was trained to do this, and that was sort of the kickoff.
What's really interesting is that you're the first person I think that we've interviewed that from kind of the inception, from graduate school, kind of formative kind of training, that was in relatively related fields such as behavioral medicine or working kind of on more common medical concerns. That's really interesting.